President Trump broke his promise not to cut Medicaid, and as a result, millions are about to be cut from the program. And he said he wasn't going to touch food stamps. Now they're about to cut millions of people from the SNAP benefits program. This is big news. I have all the details. Let's get right into it. So, what is going on? Well, the Congress, the GOP in Congress are preparing a budget bill that is going to slash Medicaid in ways that we've never seen before. And food stamps is right following that. There is $800 billion in cuts to Medicaid, which means that millions of people are going to lose coverage on the Medicare program. And there's $250 billion in cuts to food stamps, which means that lots of people are going to be dropped from the program and are not going to get access to the necessary nutrition that they need. This is contrary to the promise that the president made that he wasn't going to touch Medicaid and food stamps. Now, I'm going to give you all the details. I have all the news. There's a lot to cover today, so stay with me. And at the end, I am also going to cover an important breaking news. President Trump is going to send $5,000 in DOGE dividend. It's a new form of stimulus that is supposed to bring money that they're going to save from the DOGE program that is headed by Elon Musk and return that money to the American people. It's $5,000. Trump has confirmed that he is going to do that. So let's get into all the news. If you are new here, hit the like button, hit the subscribe button, because all we do is bring you the latest news and updates, anything in and out of Congress that is going to affect your food stamps, Social Security, Medicaid, Medicare, and all other personal finance issues that affect seniors. So before we get any further, let me know where you're watching this broadcast from. We'd like to know where our viewers are from. So give me your city and your state. Put it in the comment section right now. If you're watching from abroad, let me know, because we want to know where you're from. Where are you watching this particular video from? So let's jump into the big news. So Trump went on video many times and said he was not going to touch Medicaid. If you don't know what Medicaid is, Medicaid provides healthcare to about 80 million Americans who cannot afford it. So it's a big program and is the number 3 budget item on the list. So it is the third thing that the government spends the most money on. First is Social Security and Medicare. Second is defense. And third is Medicaid. And so he said he wasn't going to touch it because he understood that this is something that a lot of people depend on, especially for healthcare. But now he's breaking that promise, and he said he's supporting the House bill that is going to gut Medicaid so that they can prepare to give tax cuts to the rich. Trump wants to extend his tax cuts from 2017. It's going to cost $5.7 trillion to up to $11 trillion. And they have to find the money somewhere. And Medicaid and food stamps is the place they are looking to get billions of dollars in savings in order to finance the tax cuts. So here it is. Trump says Medicaid won't be touched. That was a promise he made. But House Republicans want it cut by billions. The president's record shows a consistent openness to Medicaid cuts, which would require for a big, that's what is going to be needed for them to be able to make these tax cuts work. Trump backs GOP bill that will bring large cuts to Medicaid and food stamps. So it's in the news. It's something you can verify for yourself. And this is CBS News. President Trump endorses GOP House budget bill that will make huge cuts to Medicaid and food stamps. $880 billion in cuts to Medicaid, which means that millions are going to be dropped from the program. There's no doubt about that. And then there is $230 billion in food stamps cuts, which means that a lot of people are going to lose their SNAP benefits and not get the necessary food that they need. This is to people who are desperate in need, but are going to lose benefits. Trump just endorsed sweeping Medicaid cuts. This is another article. Trump finally decided to end the GOP's internal quarreling on how to pass his budget and broke a huge promise on Medicaid in the process. For months, Republicans have been split on whether to split Trump's massive budget agenda on the military, border security, and tax cuts for corporations into multiple incremental bills, which is what the Senate was doing. And now they're putting it all in one bill, one giant bill, and Trump calls it a beautiful bill, and it includes dramatic cuts to Medicaid and food stamps. Trump drive to cut safety net could hit his voters. The new administration wants to slash aid for health, food, and housing, but many of those programs now reach the struggling working class he's courting. So it's all over the news. So what is this about? Well, let me give you the details. The first part is the scale of the cuts. House Republicans have unveiled a budget proposal directing the Energy and Commerce Committee to find $880 billion in savings over the next decade. This represents one of the largest proposed reductions to Medicaid in the program's history, targeting the program that currently serves 80 million Americans. So what is the context here? The cuts are being proposed to help finance Trump's tax cut package, estimated to cost between $8 to $11 trillion over 10 years. The administration claims it will only target waste and abuse, but analysis show that it will require substantial program cuts to make this happen. House Republicans are trying to vote on this very soon. The Medicaid currently provides healthcare to 80 million Americans, including children, elderly, disabled, and low-income adults. The program costs approximately $870 billion in 2023, making it a primary target for deficit hawks. Now, here's the thing that seniors need to be really, really concerned about. 62% of all nursing home stays are paid for by Medicaid. 1 in 5 births in this country, children that are born, 1 in 5 of them are covered by Medicaid or are paid for by Medicaid. So if 1 in 5 births are paid for by Medicaid and 62% of nursing home stays in the United States are paid for by Medicaid, which means that seniors are going to lose a critical coverage that on average, it takes $90,000 to stay at a nursing home each year. And Medicaid supports seniors that cannot pay out of pocket to stay in nursing homes and long-term care facilities. So this is serious business. Cutting $880 billion is going to affect seniors. And some states have trigger laws, which means that if the government cuts Medicaid, the state is going to abandon some of the program. So 9 states, including Virginia, have laws that will automatically end Medicaid expansion if the federal government drops below current levels. This means that over 630,000 Virginians alone will lose coverage. This is just in Virginia. So think about what's going to happen in other states. States would need to either dramatically increase their own spending or reduce services if federal funding is cut. Many states would likely be forced to choose between raising taxes or cutting benefits. Hospitals and healthcare providers, particularly in rural areas, depend heavily on Medicaid payments for survival. Any significant cuts will force facility closures and reduce access to care in vulnerable communities. States will be forced to increase costs and complexity in implementing new requirements such as work requirements or more frequent eligibility verification. This will make it harder for people to get Medicaid. So what are they trying to cut? Well, Republicans are considering nationwide work requirements that will cut $109 billion and will cost approximately 1.5 million people to lose coverage. A proposal to limit federal funding based on population will also save up to $900 billion over 10 years. Proposals include reducing federal matching funds to states, which will also save another $530 billion. Plans to limit states' ability to maximize federal matching funds through supplemental payment could also save $174.5 billion. If you add all these savings together, you are over $1 trillion in savings over the next 10 years. This is big cuts to the program that is going to impact millions of people. Now, what is Medicaid and how does it work and why is this important? Medicaid is a joint federal and state program that provides health insurance to low-income Americans, including seniors, people on disability, children, and working families. Unlike Medicare, which is purely federal and primarily for seniors, Medicaid covers a broad range of services, including long-term care and nursing home coverage that Medicare does not provide. Currently, Medicaid serves 80 million Americans and costs $870 billion annually. Medicaid pays for essential services, including nursing home care, home health aides, personal care services, medical equipment that many seniors rely on daily. And for many middle-class families, Medicaid became crucial when their savings are depleted by long-term care costs that Medicare does not cover. And here's a crucial point I want to make here. Over 12 million Americans are dual eligible, meaning that they qualify for both Medicaid and Medicare, with Medicaid helping to cover their Medicare premiums, deductibles, and services Medicare doesn't cover. So there are about 12 million seniors out there that, because of their income levels, qualify for Medicare and Medicaid. And because they are on low income, Medicaid then pays their Medicare premiums, their deductible, and services that are not covered by Medicare. So when deep cuts are made to a program like Medicaid, it doesn't only affect non-seniors, it affects seniors in a huge way, because a lot of seniors depend on Medicaid to pay not only for their deductibles and premiums and services, but also for long-term care and home health aids that helps them be able to stay home and age in place. Long-term care coverage. Medicaid is the primary payer for long-term care in America, covering 62% of all nursing home residents and being the only program that covers extended nursing home stays. Without Medicaid, many million middle-class Americans will be unable to afford nursing home care, which is about $90,000 a year. Another thing that Medicaid covers that a lot of people don't know about is home and community services. Medicaid provides crucial support that allows seniors to remain in their homes through home health care services, personal care assistance, and medical equipment. These services help seniors avoid or delay expensive nursing home care while maintaining independence in their community. Another thing that Medicaid covers is family caregiver support. Medicaid helps support family caregivers through programs that pay family members to provide care and through respite care services. This support is vital for millions of families struggling to care for elderly parents while maintaining their own jobs and families. And for seniors who have exhausted their savings paying for health care or who never had significant savings to begin with, Medicaid serves as a crucial safety net ensuring access to medical care. This program often becomes essential when seniors face unexpected health crises, chronic conditions that require extensive care. So they are making all these cuts. And who is it going to impact? Well, there's impact on disabled and elderly. More than half of all Medicaid spending goes to elderly and disabled beneficiaries. It's going to impact children. Medicaid currently covers 1 in 3 children in America and pays for nearly half of all births. So I was wrong in my first estimate. Let's think about this again. Medicaid currently covers 1 in 3 children in America and pays for nearly half of all births in the country. So 1 in 2 births in the country right now is paid for by Medicaid. Any cuts would disproportionately affect children's access to healthcare. Working families, many Medicaid recipients are employed but work in jobs that don't offer health insurance or pay enough to cover private insurance. Cuts will force these families to choose between healthcare and basic needs. And then here's a critical part. Rural hospitals and clinics are particularly dependent on Medicaid funding to stay operational. Cuts will accelerate rural hospital closures and reduce healthcare access in rural areas. It is so bad that even Steve Bannon, who supports the president wholeheartedly, is raising the alarm. Steve Bannon joins U.S. hospitals over rebellion regarding these Medicaid cuts. A divide exists between conservative Republicans pushing for deeper cuts and moderate members concerned about impact to their constituents. Several Republican representatives from states with high Medicaid enrollment have expressed reservation. President Trump has publicly stated that he won't cut Medicaid, but now he's backing them to cut deeply into Medicaid programs. It's going to impact the healthcare center that a lot of places are going to close, especially rural areas that depend primarily on Medicare. It's going to affect states. It's going to affect insurance market. Here's the thing. Major insurers like Centene and Molina, which specialize in Medicaid managed care, will face significant business disruption. This could lead to market instability and reduce competition. And then local businesses. Many small businesses rely on Medicaid to provide health insurance for their workers. Cuts could force these businesses to either provide coverage or lose workers. So let me know what you think about these cuts to Medicaid. They are really serious, and it's something that the president said he was not going to do. Trump was on record on video saying he was never going to cut Medicaid. Now he's supporting a massive bill to cut Medicaid to finance his tax cuts. Let me know what you think in the comments. Are you on Medicaid? Is this going to impact you? Is this going to impact somebody you know in your family? I want to hear from you in the comment section below. This is news you can find for yourself online because it's all over the place. They are debating the bill in Congress as we speak. This is going to happen in the next couple of weeks. If people don't make enough noise to stop this, millions are going to lose Medicaid. Now, let's talk about food stamps. In addition to slashing millions of dollars from Medicaid, Trump is targeting food stamps. I'm going to give you the 5 changes he has endorsed that Republicans in Congress are working on right now to gut the food stamps program. But before we do that, let's talk about Medicare for a second. A lot of you have been commenting about your frustration with the Medicare program. Either your plan has been dropped or you don't have the coverage that you thought you had. And so we have partnered with Chapter Medicare. These guys are the real deal. They don't work for a commission. Their goal is to help you find the best Medicare Advantage plan. And there's a short window right now. During January to March, you can switch your Medicare Advantage plan and get to a better plan. And only Chapter, the only company in the country that has access to 24,000, all of the Medicare plans, they can pick the best plan for you. Call them on the number on the screen or go into the description in this video or the comments. There is a link to a form you can fill out right now, and then they'll reach out to you and help you find the best Medicare Advantage plan or any Medicare plan that you're on that is not suitable for you, because 90% of seniors are in the wrong Medicare plan. So call Chapter. They're here to help you. They're a real solid partner. Now, let's talk about food stamps. There are 5 changes that President Trump is embracing that the Republicans in Congress are working on right now. The first one is the most disturbing. They are trying to change the food stamps program, or a huge part of it, into a harvest box. This is an idea Trump had during his first term in office. When the Democrats took over the House, this was pushed. There was a lot of pushback, and they stopped this program. They stopped this idea. Now it is back in full force. And what is this idea? Basically, it's going to take your food stamps program and then turn it into a harvest box where the government is going to pick food items, shelf-stable foods, and ship it to you each month. So rather than you going to buy your own food with your EBT card, the government is going to send you a box of food. Here is the proposal when it was pitched the first time. The largest singular cut Trump attempted was to withhold a portion of benefits and instead provide recipients a box of non-perishable food. Under the plan, the government would theoretically buy the box at a reduced cost compared with sending recipients their full benefits, and then the government will pocket the savings. However, it's going to require a lot. They want to have to ship millions of boxes, and can we really trust the government each month to ship millions of boxes of food to millions? 42 million people are on food stamps. And so that is what they're trying to do. Roughly 80% of SNAP retailers are small businesses. Is going to devastate local businesses that depend on SNAP benefits. And this is news. This is like recent news. Trump is cutting Medicaid and food stamps, and part of this is this harvest box idea. Trump's past budget has envisioned much more sweeping cuts. The last one proposed a 30% cut to the program, including a new work requirement on top of the already existing work requirement in the program, and to shift a large share of the program into a harvest box, a plan in which households would not get a choice to buy the food that they want, but instead be sent a monthly box of shelf-stable food that the government picks. This is what it's going to look like. You're going to get canned foods and shelf-stable foods that the government is going to send you each month because they want to cut billions of dollars from the food stamp program to finance the Trump tax cuts. And the Republican chair of the House Agricultural Committee, Glenn Thompson, is fully on board. He is planning these draconian cuts to food stamps, and they're pushing it through the House right now. And this harvest box idea, as I told you, has been around. And when they presented it the first time back in the day, this is the list of things they wanted to cut: $180 billion, and $121 billion of that was to the harvest box. As you can see, is that item number 1, cut SNAP benefits and shift a portion to food boxes. That was the idea they proposed back in 2021. That was blocked by the Democrats. And now that the Republicans have the entire Congress, they are pushing this idea again, and they want to take your food stamps and prevent you from buying food that you like and send you food that the government picks every month and ships it to you. And it's all written in there. It's all plain sight. So this is not something you can find yourself. This is part of the agenda. So how far, how deep do these cuts go? Well, let's look at it. Food pantries are getting ready. This is January 17, 2025. Food pantries are bracing for more demand if Trump administration moves ahead to gut the food stamps program. So they are trying to get $230 billion in cuts over the next decade through the Agricultural Committee. This represents 20% reduction in the program's current funding level. So think about it. If you're getting $100, you at least your food stamps may be gone completely if they do this harvest box thing, because they're trying to gut the program to get $230 billion to finance the tax cuts. SNAP reaches 42 million Americans, 1 in 5 children. And they are trying to vote on it on March 27. So you have time. You have about a month to call your representative, call your senator, call your congressperson, and let them know that you do not agree with this. Otherwise, this is in motion. Over 42 million people depend on SNAP. And here's the thing. It serves 11% of children under 5 and 28% of children between 5 and 17. It's across the United States. So the heaviest hit states are all over the place. It's going to, for example, Tennessee. If you pick the state of Tennessee, 880,000 people are on SNAP in the 95 counties. And if you pick a county like Shelby County in Tennessee, 51% of the people in that county are food insecure. It means that they require assistance to buy food. And so you can understand the scale, even at the county level, let alone a statewide level. They are going to reduce how much increase you can get in SNAP, which is called the Thrifty Plan. And so SNAP is not going to be able to keep up with inflation, because that's how they're going to save money. They're going to increase work requirements so that seniors up to age 65 will have to work to get SNAP benefits. And they're going to shift a lot of the responsibility to the states. And states don't have money to finance food stamps on their own. Right now, food stamps is a federal program. And now they, instead of giving benefits to anybody that qualifies, now they're going to give the states a portion of money and say, hey, you know, if you're a state like Oklahoma, they're just going to give you a portion of money and say, you figure it out. Versus the current program where as long as you're eligible for the program, you are going to get benefits. But what they are proposing is that they're not going to do that. They're going to take a pot of money, allocate it to states by population, and say, figure it out. And take the responsibility from the federal government and put it on the states. It means that millions of people are going to be dropped from the program. And then they're going to make eligibility even harder. That's one of the changes that they're proposing. And so since they have access and total control of Congress, this is going to pass unless people rise up and call their Congress people and call their senators and express their frustration and their opposition to this. Because the reason why it's easy for Congress to cut SNAP benefits, the reason why it's easy for Congress to cut Medicaid is that people do not make noise about it. There are no big lobbyists on Capitol Hill lobbying for food stamps and Medicaid. And the people who are on food stamps and Medicaid, 80 million people on Medicaid, 42 million people on food stamps, they are not making enough noise to show politicians how critical these benefits are to their daily life. So if you care about your SNAP benefits, if you care about your Medicaid benefits, if you know people in your family, or you know neighbors, or you know your own kids or your own children or your own family members that are on these programs that are going to lose critical care and critical benefits, you need to be part of the solution by calling your Congress people and letting them know that cutting Medicaid and food stamps is not okay. People think that food stamps is a lot of money, but the average person gets $6 a day. $6 a day. Today, you can't even buy breakfast for $6.20. That is the daily amount. And working families could lose benefits. People who are in jobs that are working but don't make enough money to be able to buy groceries, they are going to lose benefits. And states are going to lose flexibility and have a huge administrative burden because of this law. Local businesses are going to be impacted. For every dollar that people spend on SNAP benefits in their local area, it generates $1.79 in economic activity. So small businesses are going to be impacted. State budgets are going to be stretched. And approximately, here's where it hurts the most. 80% of SNAP authorized retailers are small businesses. So we all think that only Walmart or Target are getting, or the grocery stores are getting the SNAP business. But in fact, 80% of SNAP authorized retailers are small businesses. So they are also going to be impacted. And so we need to take action, or this is going to happen. The third thing they want to do is ban junk food purchases. The governor of Arkansas has been pushing this. This is Fox News. GOP governors call for incoming Trump officials to ban junk food and food stamps, make America healthy again. Trump officials want to ban junk food from SNAP. Past efforts show it is not easy to do. This is from the AP. So what is this about? Well, Arkansas Governor Sarah Huckabee Sanders, who used to be the press secretary for President Trump, wrote a letter to the USDA wanting junk food banned because she thinks that it's affecting her state disproportionately. And now that Robert F. Kennedy Jr. is the Secretary of Health and Human Services, now they're trying to pitch him this idea because 23% of SNAP purchases, or about $25 billion a year, are spent on what they call junk food. So now they want to cut junk food from food stamps. But here is my problem with this idea. I am all for people being encouraged to eat healthy, because unhealthy food leads to health outcomes that we all don't want: obesity, diabetes, hypertension, heart attack, etc., etc. But what people don't want to talk about is that the reason why a lot of people on SNAP are buying junk food is because they don't have enough money to afford healthy food. And so if they want to incentivize people to buy healthy food, they should increase rather than cut SNAP benefits. So you cannot be speaking from both sides of your mouth saying that SNAP benefits need to be cut, and then on the other side of your mouth, you're saying that people need to be eating healthy and that you want to ban junk food. So you're going to reduce their benefit, and now they're not going to be even able to buy the food that they need. It's going to drive people to buy more junk food with their SNAP benefits if you're going to cut it. So the opposite should be happening if we want to incentivize healthy behavior. And there's been studies that shows that junk food leads to health outcomes that we don't want, especially in children, obesity in children, etc. That is all true. But here's the thing. If you want to incentivize people to buy food that is healthy, give them the money through increased SNAP benefits rather than trying to cut their SNAP benefit. The fourth thing they want to do is impose draconian work requirements. Imposing a harsh work requirement is almost identical to House Farm Bill proposal back in the day. The proposal would take SNAP benefits away from adults up to age 65 who are working fewer than 20 hours a week, despite evidence that such requirements do little or nothing to promote employment. Imposing sweeping new set of work requirements on millions of recipients will ignore the fact that most working age adult SNAP recipients are indeed workers, that SNAP plays a vital role in supporting them. So people are working, they're making money, they're not making enough money to buy the food they need. That is why some of them are going on food stamps. And currently, if you're an adult between ages 16 to 59, you have to work to get food stamps unless you are part of the exempted population, which I've shown below. And then if you're an adult without dependent, there's extra work requirements that you have to meet. So it is all there unless you meet these exemptions. You're pregnant, you're a veteran, you're experiencing homelessness, all sort of exemptions. But if you're not part of these exemptions and you're an adult without dependents, you have to work to get food stamps for more than 3 months in any given 3 years. So these are all happening, and we have to pay attention because it may affect you or affect somebody you know. The only good news on the SNAP front is summer EBT. This is a program that supports children during the summer, children that get the school breakfast or school lunch, and during the summer lack the necessary nutrition. There's an EBT program called the summer EBT. It's now a permanent program. Each child is going to get $40 a month or $120 during the summer, and is going to be impacting 29 million children across the United States. So if you have 3 children, you're going to get $120 each during the summer to buy them nutritious food, as long as they are on this school lunch or the school breakfast program. And this is to supplement nutrition during the summer. And then the 6th change that is going to happen is that they're going to change the way they define elderly and change it from 60 for SNAP purposes. If you're applying for food stamps, elderly meant that you are 60 and above. Now they're going to change it to 65 and above. It means that they want to drop more seniors from the SNAP program. And then they're going to make it harder to link SNAP to other benefits program. Currently, if you get SNAP, you automatically qualify for energy assistance. Well, they're going to try and break that link so that you have to apply for each of those programs independently. This is what is coming, guys. And it's all available for you if you want to do your own research. All I'm doing is bringing you the news and reporting it the way it is happening so that you can decide for yourself how this impacts you. So let me know, what do you think about the SNAP benefits cuts? Do you think they should be cutting benefits to finance tax cuts? Do you think that dropping people, millions of people on food stamps is going to cause dramatic changes in people's lives? And do you think this is a good idea? I want to hear your thoughts. I want to hear your opinion in the comment section below. And then finally, let's talk about some good news, because there is breaking news that's happening around DOGE. If you know, Elon Musk has been running rampant, trying to cut spending, trying to cut waste, fraud, and abuse in the federal government. And now President Trump is confirming this idea that just came out recently, that they're going to use 20% of the savings that DOGE gets out of cutting waste and fraud from the government and return it as a stimulus check, $5,000 stimulus check. But there is a caveat, so I want to talk to you about that. So President Trump confirms DOGE stimulus check. This is Fox News. This is another Fox headline. And this is CNN. Trump says DOGE could return 20% of its savings directly to taxpayers. And CNN is saying that could reignite inflation, whether you agree or not. This is Forbes. Would you get a Trump DOGE dividend check? You may be shocked by who doesn't qualify. Well, I'm going to tell you who doesn't qualify. Here is The Guardian. Trump floats idea to give Americans 20% of savings from DOGE cost cutting. So I did the research, and here is what's going on. Investment firm CEO James Fishback proposed a DOGE dividend on social media, suggesting that 20% of the government savings from DOGE should be returned to taxpayers. This proposal quickly gained attention after Elon Musk responded that he would check with the president. It means Elon is saying he's going to go talk to Trump and then check whether Trump likes this idea. Well, it didn't take long for Trump to go on camera and say he's all for the DOGE dividend. The plan will take $400 billion, which is 20% of the proposed $2 trillion savings, and distribute it to approximately 79 million tax-paying households. This will result in about $5,000 for per qualifying household. Here's the part that they don't tell you. The proposed payments would not occur until July 2026, after DOGE completes its cost-cutting mission. Currently, this remains just a proposal with no formal legislation or congressional approval. With both Trump and Musk having expressed interest in this idea, this looks like something that has legs. While DOGE claims $55 billion so far in savings, they've only been able to verify $8.6 billion. And there's been lawsuits and challenges, and even people have questioned whether DOGE can really save $2 trillion without cutting Social Security, Medicare, Medicaid, and food stamps. So even though they want to save $2 trillion, that $2 trillion is going to come with some pain, because there is absolutely no way they're going to be able to cut $2 trillion in the federal budget without touching Social Security, Medicare, Medicaid, and food stamps and veterans benefits. But here's the thing. Only households that are net taxpayers of federal income tax will qualify for the payment. It means that 40% of American households who do not earn enough to pay taxes, federal taxes, will not get this $5,000. Of America's roughly 130 million households, only 79 million will be eligible for the payment. This intentionally excludes lower income Americans and those on fixed income. The proposal explicitly aims to incentivize labor force participation by excluding non-workers. This will affect retirees, disabled individuals, and low-income workers who receive tax refunds. No clear mechanism exists to verify eligibility, so I'm going to dig into that and get back to you on that. But here is the part that is really disturbing. In order for this to work, it's going to set up a national snitch network where citizens will be incentivized to report each other when they suspect somebody is causing waste, fraud, or abuse in federal payments. And then annually, they're going to collect all the money that they have saved from people snitching on each other and then return it as a dividend. Benefit recipients will therefore face increased scrutiny and false reports from people seeking larger dividend payments. So people who are incentivized and want the government to send them a bigger check in the DOGE dividend are now going to turn on each other and start reporting people who are on food stamps, people who are on Medicaid or other assistance programs, if they suspect that somebody is abusing the system. The system will create a culture of surveillance where citizens monitor each other's use of government services. Even legal activities could be triggered unnecessary investigation. So this is part of what is happening. So if you are for this, you need to know that this is part of what's happening. And the proposal will provide larger benefits to higher income households while excluding most that need the assistance. And the reporting incentive could lead to an increased stigma and barrier to people who have legitimate reasons to want government benefits or to need government benefits. And there's inflation concerns and how the government is going to try to implement this. The proposal faces significant opposition from both Democrats and fiscal conservatives. Neither party appears likely to provide sufficient votes for a passage. But Trump, so far, looks like he's getting everything he wants from Congress. So if he's really serious about this, I have no doubt that if he wants this, it's going to pass. If President Trump continues to push this idea of sending $5,000 to Americans, it's going to pass, because so far, everything he wants, he gets out of this Congress. But remember, it's not going to happen till July 2026. So there's a while for this to take shape. So I want to hear from you. What do you think about this DOGE dividend? Do you think it's going to happen? Do you think it's a good idea? Or do you think they should put the money elsewhere? There are multiple places they could put the money that they are saving from the waste, abuse, and fraud they are finding in government programs. For example, they could put it back into Social Security. They could put it back into Medicaid, Medicare, food stamps. They could increase Social Security benefits for seniors. There's so many better ideas or ways they could use the savings to make people's lives better than sending this DOGE dividend. Because a lot of seniors have been complaining that the government has stolen money from Social Security, stolen money from Medicare Trust Fund, and have not put it back. Well, this could be an opportunity for the government to put some of that back, rather than issuing stimulus checks to 79 million households. But that is my opinion. What is your opinion? I want to hear from you. And lastly, I want to remind you again, if you're on Medicare, please call Chapter for help because they will get you into the right program. These guys are the real deal. They are not working for commission. Their sole mission is to help you find better Medicare coverage, and the window is closing. So make sure that if you are not sure whether you have the right coverage or you're in the wrong coverage, because 90% of seniors are in the wrong Medicare coverage, call Chapter on the number on your screen or look into the description on this video, fill out the form. It's easy. Or look into the comments. I'm going to pin a comment with the link and you can call Chapter for help. So let me know what you think about everything I covered today. Until I see you on my live video tomorrow, thank you for hanging with me on this Monday evening, and I'll see you all tomorrow.